Hi, welcome back to Everyday Behavior with Dr. Mary Ann. This is our 5th video in this series, and we're talking about early intervention and early referrals. This video in particular is targeted towards teachers, daycare providers, or other professionals or individuals who may have the need to talk to a parent about a child who they suspect has a disability. So when you suspect that a child needs early intervention, how exactly do you approach talking to those parents? First, you want to be honest, but be compassionate. A, you may be the first person who has brought this to their attention. B, you don't want to be unkind. And so there's a saying that says to be unclear is to be unkind. And so you want to be clear with the parent what your concern is, that you want it to be done with love and compassion. And so make sure that you have a private conversation. I would discourage you from having this conversation as part of a casual conversation, especially if you're in a casual setting at a family gathering or at the bus stop or, at pickup or drop off. But I would designate a specific time where you can dedicate your attention and your time to it, and the parent is listening to what you're saying and you're not rushed or interrupted. And so be honest, be clear, so that you are kind and compassionate. Present your objective information, not your opinion. So I would come with maybe your CDC guidelines or an assessment that you've done or some kind of objective information that indicates exactly what milestones are being missed. And so here are the CDC recommendations for a child age 3, and we're missing a few of these things. Don't imply that their child has a disability, but just that they may need additional services or that they may need to have a conversation with their pediatrician about these concerns. You also want to give an action step or link to resources. So you don't want to just tell a person that, hey, your child isn't meeting their milestones. Are you aware of this? But you want to have an action step. So here are my concerns. I realize this might be a bit of a shock or be difficult to have this conversation, but here are the things that I'm specifically concerned about. And here are things we can do. 1, we can talk to your pediatrician. 2, we can talk to the local school district. 3, we can visit these websites. And that may be the websites that we've recommended in that first video or through our Facebook page or on my website that include the American Pediatric Physical Therapy website or association, the occupational physical therapy fact sheets, or the speech therapy fact sheets from some of our things, or it may include the CDC's website. So how can you give that action step or link them up with resources in their community? So these are all basic things that you can think about as you are talking with parents. But remember, you may be the first person to present this. They need to be listening, and you want to make sure that you designate a time to have this conversation. And you also want to just be aware that if they're not ready to hear this today, they may react emotionally, but that's okay. So if they get upset with you or they react emotionally, still love and express your concern and your compassion for them, and recognize that it may just take them a little bit of time to process exactly what you said and to kind of soak in and take in the information. If you have more questions or need additional resources to link them up with, you can visit our website at everydaybehaviors.com. You can follow us on Facebook with Everyday Behavior with Dr. Mary Ann, or you can hit the subscribe button right below to receive updated notifications when additional videos are released. Thank you and have an excellent day.